Welcome back to Men's Health Network's My Cancer, My Plan podcast series. Today, we're going to be talking about cancer equity and the Change the Odds initiative with Marianne Gandee from Pfizer and Dr. Arif Kamal from the American Cancer Society. Let's hear from them. It's a real pleasure to have you on My Cancer, My Plan. Okay, first question. What inspired Pfizer and the American Cancer Society to come together for the Change the Odds partnership? And how did the initial conversations shape the vision for this partnership? And anyone can answer first. Just would love to hear your thoughts on that.
Great. Well, Arif, it's such a pleasure to be here with you, and always a pleasure to have the partnership. And Mike, thank you so much for this platform and for your efforts to get information out to people. That is it's so critical, the voice that you put forward to the work that we're doing. So Change the Odds. The history between the partnership of American Cancer Society and Pfizer is very rich and deep. And back during the COVID pandemic, we started to work together on an initiative around screening and really surveillance screening because of the disruption for people living with cancer or people at risk for cancer getting into healthcare. So fast forward to the extraordinary investment that Pfizer made into the science with the acquisition of Seagen, which was about 2 years ago. We also wanted to make an investment into how we support people living with cancer. And we reached out to the American Cancer Society. I reached out to Arif to talk about, what are gaps that we're continuing to see for people getting to cancer. And so it was several years worth of conversation leading up to that point. But then it was an opportunity that as we made an investment in the research and development for those innovative therapeutics to extend people's lives, we wanted to make an equal investment into the experience that people have living with cancer and in the areas of screening, navigation, and access to clinical trials. But Arif, I'd love to hear, your version of our history together.
Yeah, well, listen, it's a great history, and Marianne, obviously great to see you. This is one of those things that cancer at its surface is a very kind of daunting, large problem, right? It's something that scares a lot of people, can bring a lot of anxiety, and that's rightfully so. Listen, from a men's health perspective, 1 in 2 men will hear the words "you have cancer" sometime in their lifetime, and that's a flip of a coin, right? And while that presents a really important challenge, it means that a challenge like that really requires 2 very large, experienced organizations that have a national footprint, who have trust and credibility in this space, who have deep knowledge of the challenges that patients face. Those 2 organizations really need to come together. And for us as ACS, we're about 115 years old. Pfizer just celebrated their 175th birthday. Why not have 2 very large, storied organizations come together? Importantly, because we've made a ton of progress in oncology in the past 30 years. We know that mortality is down in many different cancers, but not all. Prostate cancer is a good example where we're starting to see this trend go in the wrong direction. Actually, mortality, that's the risk of dying from prostate cancer, actually going up in the past several years. And so really there's both an acknowledgement of 2 large partners coming together who've been working at this for a while, but also a sense of urgency around closing some of those disparities and barriers that we see out there. And so this partnership is really a couple things that are principles. One, it's community focused. So it's not a top-down approach. It's really a sort of all people approach in terms of being into communities where people are living their normal lives, not generally thinking about cancer, but importantly, trying to bring it to top of mind. How do we prevent it, detect it early? If we have it, how do we get through a very complex health system? That's really the concept of navigation. And then how do we get to the cutting edge therapies that may exist that are found in clinical trials? And you can see how those 3 principles of the program really make good sense to bend the mortality curve in prostate cancer and bend sort of the suffering curve in a cancer like breast cancer.
This partnership's focused on breast and prostate cancer, but really was grounded in prostate cancer. And to Arif's point, we bring the facts and figures that American Cancer Society keeps track of on the trends that of various cancers around the globe and in the US, of of what's happening, the conversation really started grounded in prostate cancer and some of those trends going in the wrong direction. And I think that really the beauty of focusing on both breast cancer and prostate cancer is you start to focus on the ways in which people interact together. So you mentioned at the top of your show how important it is for the women who care about their men and the boys in their lives, thinking about the connectivity between these two diseases and thinking about how people execute their healthcare. Sometimes the female being the chief medical officer of the family, there's a real empowerment and symmetry between those diseases in which people can help support each other. But this was grounded really in those unfortunate trends that we are seeing in prostate cancer.
Mm-hmm.
Yeah, and I've often said half the work that I do educating the public about men's health is with women, just for all the reasons you just detailed. Yeah. We all love anecdotes. Can you share a story or a moment, whether it be from a patient or a caregiver or just your own experiences that really captures why this partnership matters, change the odds, what that means on a human level?
Sure. I mean, sadly, there's too many anecdotes to pick from, but I'll share a recent one. I've shared a bit about my family in the past and why I've dedicated my career to advocacy and oncology. But recently, I received a call from someone who actually is affluent, and they had an insurance change, and they were having trouble getting to their typical therapy. They're living with a metastatic breast cancer. And they knew me. So they reached out, and that phone call was really difficult because they basically were saying to me, I'm trying to choose between staying on my medication or not burdening my family with any financial issues. And that's a call you never want to hear, and you don't want to hear it from a friend. And luckily, she knew to reach out to me, and I helped kind of guide her to materials and resources like those that you can find on the American Cancer Society, and kind of help get her to a place of empowerment so that she could act upon those. And a week later, she called me and she said, I was able to, using information I found around what I have access to for financial navigation, get to the therapy that my provider prescribed me. And that's a good outcome. But for that N of one, that's not what most people experience. So when I think about the Change the Odds platform, it is that information that lives on the American Cancer Society to help people feel empowered in screening, to help people find resources for navigating their disease, real resources. And I think that is the impact that we want this to reach more people, so that they have that information and that they are having a good experience while living with metastatic cancer, living with disease, that they don't have to be burdened, that they have some support for quality of life. But that's just one incident that was very recent and top of mind.
Yeah, I mean, I echo what Marianne says. There's way too many stories. I'll share a personal one. Prostate cancer is the leading cause of cancer in men. In fact, about a third of all cancers diagnosed in men this year will be prostate cancer specifically. And the prostate is one of those organs that we don't think a lot about until it kind of goes bad, if you will. And for men, it's sort of an important part of the anatomy, an important part of the body. And so, but it's not one we think much about. And the screening tests oftentimes get missed, and sometimes the messages about the importance of that can be mixed as well. So I grew up in a small town called Warrensburg, Missouri, east of Kansas City, in very rural Missouri. The town I grew up in was 15,000 people, and I actually spent my summers baling hay and doing lots of other things that people may not presume based on the course of my career. But I credit a lot of my values and how I've raised my kids and my family based on how I was brought up in a very small town. Small towns are endearing, particularly in rural America. There's much I loved about it, except for the inequities in access to highly specialized cancer care. So when my grandfather, my mom's dad, got diagnosed with prostate cancer, we really ran into those challenges that everyday people run into. And, of my parents were both college professors at the local college. And so we're a learned family, right? Who understood a lot of things. And yet at the same time, what prostate cancer presents is a unique journey. One, in terms of understanding the early diagnosis and diagnostics. There's complex things like MRI and different blood tests and things that can get done. So there's complexity even in arriving at the diagnosis. There's complexity getting through the system, because in play you have radiation oncologists, you have urologists, you have potentially other surgeons and radiologists as well. And so lots of ologists that can be involved. That can also involve multiple places to get care, a clinic here, a hospital there, an OR here. And if you're in rural America, it's not 5 minutes away. And that's what we face. So having to drive hours this way, hours that way, and to put it all together is really the importance of navigation. And in particular for my grandfather who had early stage cancer, fortunately so, there were many questions that were still needed to be answered. Is it better to go this way, this way? Do we add a little therapy or just watch it? Do we test for this, that, and the other? Which means the role of clinical trials ends up being really important. And for us, access to clinical trials was very variable because we weren't near a very large university or center. And so, that's a personal example of what I know a lot of people are facing. And what that fundamentally means is that because of that access barrier, we start to see those outcomes be different too. So for example, in rural America, stage for stage matched, meaning if you have a stage 1 prostate cancer in Warrensburg, Missouri versus a stage 1 prostate cancer in New York City, what you're going to find is you are more likely to die of that cancer, even though the people are essentially the same with the same cancer, more likely to die of that 4 or 5% higher in Warrensburg, Missouri than in New York City. And that speaks to the need for investments in navigation, clarity and education around early detection, and then importantly, access to trials when they're available.
Well, you kind of led us, it's a great segue into the next question, which is, when we talk about changing the odds in cancer, what disparities, what barriers were Pfizer and American Cancer Society specifically aiming to address? And how did you identify these as the most urgent areas of impact?
Yeah, so like I said, Mike, we've had a longstanding partnership with the American Cancer Society, and I think that the top note was really we saw some really concerning trends around just screening rates being lower. And especially when you think of for Black men living in America, if you're not going and getting screened, or if you don't have an awareness of your family history, then you probably are going to show up with a later stage disease. And so we were seeing those actual trends happening. And then in addition to that, like Arif said, in both urban and rural pockets across the U.S., there's true barriers to access to care. So the first thing was, how do we address getting people empowered and armed with information to activate around screening? And how do we also make sure that at the same time we're understanding if there's a stigmatization against screening, like a fear of cancer? How do we work together to remove that fear? That was the first thing. The second thing was in the arena of navigation. It's only been very recently in 2024 for Medicare patient that there is a reimbursement code now for navigation. So navigating, like Arif just detailed for his own family, is, I would say that it's more of a luxury than an actual something that was executed on because it did not have a mechanism for healthcare providers to pay for that navigation. And now it does. So making sure that people know and have an awareness of that, and that they're asking for help to really traverse a very complex system once you are screened. And if you are diagnosed, that you have that help to support you. And then the third thing, and I think a really key thing, is clinical trials. And Arif, you and I have talked about this a long time. In the US, clinical trial enrollment rates I think they hover around about 7%, right? And for oncology, clinical trials oftentimes are standard of care. And there's a lack of information around that. There's almost like a misinformation to that. And I think there's a disservice to people, right? So you've been screened, you may have been diagnosed. You're in the hands of whatever information you have within your community, and you're in the hands of the information that your providers have to help you understand the options that you have in your care. And I think that it is a disservice for people to not be given options around clinical trials because there's potential to be part of the latest and greatest science. So when you think about it in that way, and I'm really oversimplifying the system, with the trends that we saw both in breast cancer and prostate cancer, with the trends that we saw in rural and urban regions, we looked at this regional data. And with those three key areas, we saw an opportunity to better tether together information that our organizations have and to wed that to when you think about how big Pfizer's footprint is getting that information out of the door into the hands of people. This year alone, we've gotten about 10,000 paper print resources out, which to me shows that there is a real need and there is a desire for people to have that education. And that is changing the odds and how people think about cancer and how they think about supporting themselves and their families and activating. But Arif, I'd love to hear your thoughts.
Yeah, I mean, there's a real recognition here that there are, particular disparities that exist across the country, and if you think about what really drives those, there are multiple factors. I mean, we've got some work to do. And clearly there are some differences, for example, between racial minorities versus other populations. The classic example in prostate cancer is both an incidence and mortality issue. Black men are 70% more likely to be diagnosed with prostate cancer. And so again, as I alluded to, right, the diagnosis itself is not a straightforward thing. There is a workup involved, there's specialists involved. And so it's not sort of a yes or no. There's a lot of complexity even in that process that we need to think about. But importantly, also, Black men are up to 2 times more likely to die of the disease than whites, Hispanic, or Asian Americans. And so that also speaks to lots of things that we want to try to address. And a component of that can also be access to clinical trials. Marianne's absolutely right. The number is 7%. And I think there's a lot we can learn here actually from other experiences. I'll give an example to pediatric cancers to create an analogy. In pediatric leukemia, so that's kids with blood cancer, 20 years ago, nearly 80% of them were dying of leukemia. And now today, it's only about 10 or 20%. So something shifted in one generation that really got from a leukemia being a really scary thing where the vast majority of kids died to one where it's not. So what happened? Well, in pediatric leukemias, it became, as Marianne mentioned, standard of care to be in a clinical trial. Not that it was experimentation, but that it was about access to innovation. And that pivot was really important. And our colleagues in pediatric cancers did it really well. And because kids now went from a clinical trial enrollment rate of being close to what we are now as adults to really being that 80-90% level, what you saw is the cure rate came in right behind it. And so there's a playbook there that we can learn from to apply to the adult setting, because 7% means there's a lot of room to grow. But to help people do that, we have to think about the reasons why people may not participate in a clinical trial. It may be around education, misunderstanding, or sort of just not knowing what they are or being scared of them for really good reasons of where we've had missteps in clinical trial enrollment and implementation prior in this country. But where we are today is far from where we were before, but not every person thinks about that or may know that. So it's our responsibility to educate them. We do that within the Change the Odds partnership. But not only that, we think a lot about, well, let's say someone says, okay, sounds like a good idea, Dr. Kamal. Now what happens? We realize that those real life logistical barriers start to creep up, is that people want to do this, but if they miss work, they're not going to be able to put food on the table. How do we take care of that? If they need to go somewhere for a clinical trial, where are they going to stay? How are they going to get there? And those are those real life practical help that we bring forward in this partnership. So really the beauty is not only thinking about where people are, but it's thinking about the complexity of the disparities that start to show up, the barriers that start to show up, and how can we start to tackle them one by one by one by one so that we can get them out of the way, they can get to the right care.
Great stuff. Patients and their lived experiences, that's really what this is all about, right? How did you all integrate into the design and implementation of the initiative, the Change the Odds initiative, and can you share how that influenced the strategy itself?
At the top of this call, Mike, you shared Arif's illustrious career. And one thing that you missed there, though, is that he was part of Front Porch Conversations with Patrick Dempsey. And that was basically our effort to get some traction in the rural conversations. But what people don't know is behind the scenes, as we are developing, how do we get the messaging out, and even working with, well, I think, Arif, you have better hair than Patrick Dempsey, but working with movie stars like Patrick, we are working equally as important with groups of patients advisors. So here at Pfizer, we have patient centricity advisors, and these are national leaders of other advocacy organizations that help represent and reflect the voices of their constituents. But we also have patient-centered steering committees, which are a group of patients and their caregivers and advocates. And we have one of these for prostate cancer that Sherry May Rogers leads for us. But this steering committee is something we bring to them ideas before we execute. So before we went down that journey with Change the Odds, is we talked about how is the best way to get this word out and the reach, and how do we do this the right way. So that's one of the ways, is they're informing the development and design along the way. And then for that specific campaign, and I think it was really beautiful because, again, it's trying to empower people to even start to have conversations in areas where maybe you don't talk about your health, and maybe you don't talk about the struggles that you're having in reaching a provider. You suffer silently. And so empowering those communities to have real front porch conversations, we brought in people living with cancer to join Patrick and Arif to talk about, their own experiences. And again, to try to make sure that people can approach this and open the door to conversations, and those conversations open the door to opportunities, and those opportunities mean that you're going to be more likely to connect with providers, connect to the resources that you need, and have more moments then that matter on those front porch conversations with your family.
Yeah, I appreciate the compliment, Marianne. I think that Patrick Dempsey's a wonderful person and obviously a great actor. I think, though, that we have a lot in common, even though I don't act. He grew up in a small town in rural Maine. He took care of his mom with ovarian cancer. I took care of my mom with breast cancer. So, we instantly clicked because apart from our day jobs is our humanity. He's an actor, I'm a doctor, sure, but within us, within our hearts, right, is a very real shared experience about the effect of cancer on a family. And importantly, there's this pivot that's really important that's happening right now, that's going from cancer being sort of, I don't know, bad luck, bad genetics is probably the best way to say it, right? Cancer we don't like talking about. One, because it's scary, but it's scary because we don't have control. Human beings are very simple. We like control. We like agency. We like to know that we can take charge of something in our lives. And when we can, we go deep in on that topic, right? We do that. It's part of who we are. Cancer for the longest time has not been something that we can control. The journey through navigation, the incidence of it, the diagnosis of it through prevention and early detection, right? Those have not been things at our fingertips for the longest of times. And yet, where we find ourselves today is nearly half of all cancers have a modifiable risk factor. And so for, about half of all cancers, there's something we can do today when we go grocery shopping, when we spend time with others, when we sleep, when we spend time at the gym, that can actually materially alter our future from this thing that we all agree is scary and we'd like to get rid of altogether. And so I think there's a lot of hope here that comes out of this, that as we talk about the challenges, right, the challenges themselves are not the fun part to talk about. The hope that we can do something about it is actually where all the excitement lies. And I'm really excited to see now the next version of our work together around changing the odds, now focusing on the Black and African American population, who, as I mentioned, are disproportionately affected not only in prostate cancer, but in breast cancer, but also really making these topics a little more relatable, a little bit more kitchen table esque. Right, when we talk about kitchen table topics, and politicians talk about that, they talk about the economy and jobs, things that everyone sort of wants to talk about, cares about, because it affects all of us. Well, I would say cancer is a very similar thing, except that we've never had really something hopeful to talk about. And now what we're doing with Tia Mowry and others, and through series and putting out there, is really then talking about how we can make this a kitchen table conversation about what we can do to reduce our risk, what we can do to help each other, what we can do to get through a really complex health system. Really demonstrates the evolution of this program together and how we work together. Still community based, still about real people. And for us in patient support in the American Cancer Study, listening. I mean, patients and caregivers are our constituency. Mm-hmm. So paying attention to what's on their minds ends up being really important, and connecting with people who have, big platforms, but are also relatable, ends up making it so that we can hopefully make this topic less scary and more likely to be talked about. Because when people engage, we see them participate in behaviors that will change their future from this dreaded disease.
So, Marianne, what does success look like for the partnership in the coming years? And what's so important with all programs, how do you measure success and progress?
Yeah, it's, this is an instance of success, Mike, just being able to be here with you and share with your audience to make sure people have an awareness of change the odds, and then tap into some of the resources to empower themselves. But we are measuring this along the way. We launched on World Cancer Day back in February of 2023.
Yeah.
So we're headed into our third year of this partnership. And a lot of that starting effort was laying the groundwork and foundation to make sure that we have connection and direction and alignment with our teams. So I think, some of the ways I shared with you, we're getting the resources out there. We know that there is a demand for them just from the print resources. We've been out and about in different settings and sites. So we're measuring how many people we're serving and reaching. And one of the really cool things I think to highlight this year, one of the big wins, is we were able to work. American Cancer Society has this great tool for screening, Cancer 360. It's an assessment, and Arif can talk more about that. But we really worked together. And earlier this year, we were able to broadly launch that during the big game, is create awareness around our efforts to support people to access tools and resources for screening. And that was really cool, because that goes out to millions of people, not just in the US and around the globe. And then I think the other thing, you go from those big national wins of awareness and then to like real dynamics within states. So, in Pennsylvania, we've got a team on the ground that's been working to try to make sure that there's awareness around information for PSA screening, for prostate cancer screening. And I think that, when you think about what this team is doing for Prostate Cancer Screening Awareness Month, they put a call to action out around the 360 tool, but they've also been working with the Pennsylvania Department of Health to make sure the Department of Health's informatics office is putting forward things to serve people, to serve men, a 5-question prostate cancer screening module. And they put that into a 2026 behavioral risk factor surveillance system survey. And they haven't included this since 2020. So it's like you go from these broad wins to even these like incremental wins. Mm-hmm. And just even if one person listens to this podcast and points themselves or their family to the Change the Odds resources, to me, we won't ever be able to measure that, but it's a win.
What really characterizes this program and collaboration together is about impact. I mean, we weren't busy getting busy. We weren't planning to make plans, right? This was about real life implementation, because there is an urgency of now, right? Because one, there's a ton of hope, as I mentioned, but we have to get that message out. there's a ton of suffering that exists, and we have to address that because we have the tools to do that. But it really takes large platforms to get that out there. I think for Cancer Risk 360, as Marianne mentioned, it really is then giving people practical tools at their fingertips to say, okay, I heard Dr. Kamal say nearly half of cancers have a modifiable risk factor, but what does he want me to do? Well, Cancer Risk 360 will tell you exactly based on information that you give in a tailored way back to you, such that when you go grocery shopping today, I guarantee you it's going to give you a recommendation of something different to buy that will reduce your risk of cancer. And what amazing message of hope that in your hands is the ability to change your own future from cancer. When we look at this issue called cancer, I think it's really important to look at the scale of it. I mentioned 1 in 2 men, 1 in 3 women over their lifetime. But let me say it in a different way. About 6% of all Americans today have cancer or are cancer survivors. About 35% of people are a first-degree relative of a person with cancer. So when you add that up together, that's another 40%. So about 40% of Americans either have survived or have a first-degree relative with cancer. Now you add the number of friends and family and others, neighbors, so on, you start to get to a number that goes above that. So this is really something we can all lean into as being allies to each other, integrating the messages to our own lives as well. And what that's looked like so far, again, Marianne mentioned, we are in the heart of this collaboration together. We've counted that over 17 million lives have been touched so far through this engagement. And importantly, that is across multiple geographies. So 22,000 different communities across the US and territories means that really we're getting to the scale that we hoped for by 2 big organizations coming together. And we've got more work to do. So excited to see how that 17 million number gets even larger over time.
Okay, for our listeners, whether they're patients, caregivers, advocates, or healthcare professionals, if there was one thing they can do today to help advance the mission of change the odds in their communities, what would that be?
One thing that you can action on is have those conversations, and instead of talking about politics, talk about cancer screening. And I think the other thing is go and visit the site and the resources and connect those to yourself, your friends, your family. It's extraordinary how much the science has moved forward, and let's move the humanity forward with that, and supporting people to get to that information. So the one thing is go eat your turkey, but bring along a conversation to have with your family to change the odds for them. And I think you can do it in a delicate way, and it's a good thing to talk about.
Yeah, 100%. For folks who want a great resource, we put them all together at cancer.org, which is our website at the American Cancer Society /Change the Odds. And really, that's really what this is about. I mean, it's a great name for a program, but it also accurately describes what we're trying to do. The odds, without people taking action, as I mentioned, aren't great. They're a little scary. 1 in 2 men, 1 in 3 women, right? But then I also told you the hope that maybe half of them can be potentially prevented or modified. But that means we have to take action. We're taking action as 2 big organizations, but we also need friends and family and caregivers and others, those that you're going to be around for Thanksgiving and the rest of the holidays and so on, really important. And so I think that we have to demystify this thing called cancer, that it's really hard to get together and have this conversation. I agree. For listeners who are like, well, sure, but isn't that going to be tough? Yeah, probably at first. I'll be honest with you. It'll probably be at first, because how do you sort of bring it up? Here's how I would do it. What I would say is, hey, I heard that cancer care is changing, that there's so much hope to prevent this thing. And there's an opportunity then to learn about one's own risk. In Cancer Risk 360, we ask about that. And the risk comes from your family history. So it's really important as a family that might be the time you're together and you say, I remember a story that great grandma had a specific type of cancer. A great grandpa had a specific type of cancer. What kind was it? Because it's going to be important as I think about my risk, what that was. So you start to get a better, more granular, specific sense of the family history. I think that's really important. 2, I think there's a really important power in cheerleading each other. when I was talking to my kids about this, right, it's very clear that whole grains, like in wheat bread, is better than sort of refined grains in white bread. But I'll be honest, I like white bread a lot more than wheat bread. I do. I was raised that way. I said I was raised in a small town in the Midwest. That's what we ate, was white bread. Okay, so I know cognitively what I need to do. And again, this might sound like a silly example, except that we know that the rising rate of some cancers, particularly in people under the age of 50, is correlated with some of these nutritional dietary things. And whole grains is not a small component of that. It's actually a major component of that. So I'm giving you my story. How do I do that? Well, I think community and family helps. You go, well, great. Well, Arif, we're going to, make it at Thanksgiving. We're going to use some stuffing actually made with some whole grains instead, and see, we'll put enough herbs in there and stuff. See if you taste the difference, right? So now you're convincing me to do something different through kind of a little bit of a fun family challenge. And that sense of community, that we're all in it together to make for a different future, I think is exactly what happens around the holidays as we get together and think about, reflect on where we've come from, but who we are, who we're going to be, etc. And I think adding in that conversation about cancer, not as a scary thing, but as a let's defeat this thing through doing things together, becomes a message of hope. And what better time than to have that conversation together? So that's my advice to everyone out there. And eat wheat bread. That's my other advice.
What was that? Say that one more time.
Eat wheat bread. Don't listen to Dr. Kamal. It's fine. It's been fine. We've made that change in our household here. And listen, I'm still here. So we're doing it. And, at the end of the day, my kids, right? Imagine your family says to, Dad, I don't want you to get colon cancer. Thanks for eating wheat bread. And my 8-year-old said that to me, and so that's those moments, right? Where you figure out, yeah, it's hard. These conversations can be difficult, but there's so much to be gained when we come together around these topics. And there's so much urgency and need that we really need to now and do it in a way that brings us together.
Very well said. Thank you both, Marianne Gandee and Dr. Arif Kamal, for being with us today. It's been an incredibly informative conversation, and I know that our listeners will take a lot away from it. But before we wrap up, I want to make sure folks know how to stay connected. If someone wants to follow your work, reach out to you with questions, or learn more information about the initiatives you're leading, what's the best way for them to contact you or to find additional information?
Sure. I mean, you can type in change the odds. But for me, if you want to connect with me on LinkedIn, I'm pretty active on there. Feel free to send me a direct message, and happy to support and connect. And Mike, thanks so much for having us today.
Yeah, You're thanks, welcome. Mike. I echo the same approach. Cancer.org, change the odds. Connect with me on LinkedIn as well. I would say the other thing is reach out to someone that who's going through a difficult thing, cancer or their caregivers, and stay connected to them. We know that the cancer journey can oftentimes be socially isolating for many people. So I think connection, to your point, Mike, is really important, certainly to us as advocates and experts in this space and leaders in our two organizations. But we just need to stay connected overall, because we know that one of the major influencers of outcomes with people with cancer is to have a strong and continuously engaged social network. And so we all have the power not only to change our future, but the future of others we care about by just reaching out and staying connected. And so I just want everyone to, really embrace that they've actually got more power than maybe they thought they had when this podcast started, about what they can do. And importantly, you don't have to go to medical school to change the U.S. outcomes from cancer. We just have to be engaged.
Yeah, and it's also very important to have a purpose and a passion along your cancer journey as well. Would you not agree?
Yes.
Absolutely. You can hear it in our voices for sure.
Yeah. I can.
Yes. But I hope everyone else gets a little bit inspired today as well.
If you thought of someone while you listened to us talking, please reach out to that person with a text. I think that's more important than connecting with me on LinkedIn. Support in your community.
That's right.
Thank you.